So as the video starts, I will show you a nursing care plan. This is it. You can see it so well. And as the video is going on, I'll be giving you samples of types of nursing diagnoses and how to formulate them. Okay, from the problem to the etiology to the signs and symptoms. You'll be seeing a couple of them popping in, and I'm hoping that those are going to help you. So here goes the nursing process. I hope this is going to help you in your future as you make your nursing decisions. This is the most important tool for the nursing process, and that is called the nursing care plan. So the easiest way to remember this is ADOPID. Okay, so A is assessment. I have it there. Okay, you can just look it up. So A is assessment, D diagnosis, O outcome or expected outcome, P for planning, I for implementation, E for evaluation, and D for documentation, ADOPID. Okay, so I'm going to tell you this for free. The most important step in all this in the nursing process is assessment. If you do not have the right assessment for a patient, you definitely are going to miss out on everything, because you're going to have the wrong nursing diagnosis, and once you have the wrong nursing diagnosis, you're going to plan for the wrong thing and implement the wrong thing. Okay, so let's start with assessment. Well, the most important thing for you to know in the assessment is that this is where we collect data. Okay, so we collect data through physical examination, and there are two types of data. You can have objective data and subjective data. Objective data is what the patient tells you, and subjective data is what you can see. Okay, is what you can see for yourself. For example, you walk in and the patient is vomiting. That is going to be subjective. Or you ask a patient something and they tell you. Now, objective is probably when you take the observations. So in general, subjective data includes just the patient feelings, just their views and everything, what they say to you. But objective data is data derived from physical examinations, lab results, and your observation times. All right, so when you're doing the assessment, this is what you need to look at on the first thing. Like, of course, the physical examination is head to toe, but on the nursing care plan, which is a tool now, you're going to focus on the issue, on the main issue that you see on the patient. Okay, moving on. After you've made your good assessment, you've collected your data. Of course, you've already talked about the objective and subjective. Now you come to make the nursing diagnosis from what you saw in the assessment. Please remember that if you're making a nursing diagnosis, it has to be the priority nursing diagnosis. Okay. For example, a patient has rash. From your physical examination, you saw that a patient has rash, and then the patient is also vomiting. All right. So between the rash and vomiting, you need to know what is the priority. And what is the priority? I know you know that by now. Priority is going to be vomiting. Why? Because it is in the ABC. Okay. Somewhere in the circulation, vomiting is going to come in there, probably because of hypertension and all that, because of fluid volume deficit. All right. So the nursing diagnosis that you write for a patient has to be the priority, and you have to make this nursing diagnosis bedside so that you get the right nursing diagnosis at this time that we need to be working on. So after you do that, in the nursing diagnosis, you also want to remember you are dealing with the actual nursing diagnosis before you can go to the potential. So in as much as you made the priority nursing diagnosis, you have to make sure that it is an actual diagnosis. Okay, so what is the difference between an actual nursing diagnosis and a potential nursing diagnosis? An actual nursing diagnosis, for example, we've just talked about a patient vomiting and a patient having a rash. An actual nursing diagnosis in that case scenario is going to be electrolyte imbalance. Okay, there's electrolyte imbalance related to probably the vomiting and all that, but you have to and of course, as evidenced by now the lab results that you have. Now that is going to be an actual nursing diagnosis. But a potential nursing diagnosis is probably going to be that of this patient when they have rash. They have this rash, nothing is so big about it, they are just itching. So what is likely to happen if this patient is itching? They are likely to get an infection. So now that is probably going to come second, risk to infection related to the rashes and the continuous itching that's exposing the skin, the inner layers of the skin. All right, so note that in the nursing diagnosis, and be very keen, especially when you're writing the etiology. The etiology of the disease has to be in the nursing way. Please do not write, for example, a patient has malaria and they have fever, so you want to write fever related to malaria. No, that is a medical diagnosis. We do not have that. So you have to write the disease process. You need to know the disease process that you're going to do the etiology with. You understand me? And of course, evidenced by is probably going to be the fevers that are high. Now, in our previous case that we were talking about, it was vomiting. So we're going to have an electrolyte imbalance related to this, and then as evidenced by probably low potassium levels of about 2. Now, it is important to write these things down in your nursing diagnosis, because when we come to the next step, which is the outcome evaluation, this is where the SMART comes in, and this is where you're going to write everything in detail. You might want to write something like, it's specific, measurable, attainable, realistic, and timely. That is SMART. But most of the students miss out on the measurable part. Okay, if you didn't write anything on your nursing diagnosis to come and use in the outcome, the two are going to go wrong. Okay, so they need to marry. For example, the electrolyte imbalance was evidenced by potassium levels of probably 2. So in the expected outcome, we want to write that probably have the patient with the electrolytes of above, probably 3.5, or within the ranges of 3.5 to 5, which is the normal ranges of potassium. And of course, we want to say as evidenced by those lab results, right? And it has to be timely. What does timely mean? For example, I want to restore electrolyte levels for a patient. That is not going to happen within a snap of a second. I have to wait. It's going to take about probably 12, anywhere from 6 to 24 hours. That's when I'm sure that I can restore those electrolyte imbalances. It's not only potassium, other electrolytes are impaired when a patient is vomiting, right? If it is pain, if pain was your was your main assessment finding, you want to tell me on the Becker's FACES scale, what level of pain was it? Was it 5? Was it 8? Now, when you come now to the expected outcome, is when you're going to tell me how far are we going to reduce this pain? Is it from 8 to 5, and what we're going to use, right? Now, from the expected outcome, we go to planning. Okay, planning. We are working with electrolyte imbalance. If I was working with a patient that has an electrolyte imbalance, I'm certain that ringas lactate is going to be there because it is full of electrolytes. So I am going to have that as in my planning phase. Administer IV ringas lactate, or IV fluids generally, normal saline, D5, and ringas lactate probably, because also of hypovolemia. They are vomiting, they're likely to have low BPs as well, right? So that is another thing. So in the planning phase, you write what you're going to give to the patient. Then after planning, we implement. Now implementation is when you say IV ringas lactate administered at this time by me or by someone else. You write the name there. So the last bit is usually evaluation. Now what happens in the evaluation phase is is we need to talk about the goals. In your expected outcome, what was the goal? It was SMART, right? So it was timely. The last bit of SMART is usually timely. So we need to go to the timely bit and see how we did. So evaluation is going to happen when you are supposed to reassess the patient again. Probably you said, for example, mine was electrolyte imbalance, and I said anywhere from 6 to 24 hours. So let me take the case of 6 hours. I am going to do another reevaluation at after 6 hours. For example, it was 12 p.m. when I started when I implemented my first action. Then in the next 6 hours, that's going to be 6 p.m. I'm going to do an evaluation and see if the goal was met. If it was met, then I say goal fully met. Okay? If the goal was not met, I say goal not met. Maybe probably it was partially met. Or the goal is still ongoing. Okay? Like we are still working on this goal. They continue reassessing this patient until that goal is completely met. Alright? So I have attached a quiz by Julie Gen. I found those quizzes, those questions actually very interesting for the nursing process. You can go in the description of this video. When you click on the link, it is going to redirect you to another tab, probably in Chrome or Google, and you can go and take that quiz there, see how well you understand you understand everything, how you understand this content. And if you need any further elaboration, then I'm here to help. Okay.